Neurosurgical emergency. So neurosurgical emergency is not a single disease condition. All right, it's not a single medical condition. It's groups of medical conditions. Okay, collectively we give them a single name. So they are actually time critical conditions. So they require what? Immediate recognition and intervention. This is because you want to prevent permanent neurological damage or death. So they often involve, that's now trying to list the symptoms. So let's not actually jump, let's follow it bit by bit. So what are the types of neurosurgical emergencies? The first example there is traumatic brain injuries. So things like epidural hematoma, subdural hematoma, intracerebral hemorrhage. Okay, so management, you have to do, CT scans, resuscitation, and just try to get any bleeding out. So acute hydrocephalus is the next example. That one, there's obstruction of the pathways of the cerebrospinal fluid, so there's like accumulation of the cerebrospinal fluid back in the brain. Okay, so they have to also drain it by surgeries like ventricular peritoneal shunts. The intracranial hemorrhage, you have things like hypertensive intracerebral hemorrhage, aneurysmal subarachnoid hemorrhage. Okay, management is blood pressure control, okay, and everything. The next examples, you have spinal cord compressions. That one is just literal. The spinal cord is kind of like collapsing on itself, So traumas, epidural hematoma, metastatic tumors. So sometimes some cancers have spread to the spinal cord, thereby making those bones weak. So treatment is what? High dose steroids, then urgent decompression, laminectomy. So brain abscess is the next example we have. So brain abscess, there's what? Collection of pus in the brain. Of course, somebody with this condition will rarely survive. Okay, somebody with this condition will rarely survive. Even if they survive, one portion of the brain can be damaged forever, causing a lot of issues. So you can present with fever, focal neurological deficit. That means the part of the brain that is affected, you'll be having signs and symptoms related to that part. Do you understand? So management is antibiotics, because most of the times this pus collection is usually due to bacterial infections. Then we have acute stroke with large vessel occlusion. Okay, it's another neurosurgical emergency. So principles of management is you have to early on diagnose these conditions. ABCD of resuscitation, intracranial pressure management. So sometimes you use all those diuretic drugs to basically put out the retained fluid. Okay, so if you can't handle it, you have to actually transfer such patients to a neurosurgical center.